Hello everybody, my name is Jason Hafner and I'm the Chief Development Officer at Fast-Paced Health. I'm here interviewing Lindsay Quebodeaux, who is a physician assistant, and she is the telehealth team lead for Fast-Pace. So welcome, Lindsay.
Thank you.
Why don't we start by telling us a little bit about your medical background and your personal background and really what drew you to telehealth?
So I'm a physician assistant. I started working with Fast-Pace in Lake Charles, Louisiana, which is where I'm from. I then moved to a clinic director role in West Monroe, Louisiana, which is where I started participating in telehealth as a provider in its early stages. As telehealth became more popular, I started to really, fall into that, and I wanted to see it grow even further. So recently, I have become the telehealth team leader, but we really enjoy telehealth, and it's something that I'm really passionate about now. So yeah, that's the story of it.
Yeah, so this is something, telehealth is not necessarily new, but it is growing. And I'm sure there's a lot of factors to that as to why the current environment that we're in. Why don't you speak about that a little bit and how our services can help?
Sure. So we know that recently COVID has kind of taken over the world, if you will, but that has really opened up the doors for healthcare in regards to not having to be in person to receive medical care. So with this, our telehealth story has started to blossom in the sense that we are able to bring healthcare to people that are able to stay at home, able to follow CDC guidelines, protecting themselves and others without having to get out of their house for reasons that might be unnecessary. So we are able to bring care to those patients, whether they're at their home or at the clinic.
Talk about the patient experience. You're behind a screen. Sometimes you could be at home, sometimes you could be in the clinic, but you don't necessarily have that intimate connection with the provider due to the screen. Is that a barrier to getting good health care?
I feel like that's probably the most common misconception about telehealth, is that it's not as intimate as it would be if you were in the clinic. But I do want people to know that we really take that very seriously, and we want our patients to be the most comfortable that they possibly can with us as a provider, because that is extremely important with a provider-patient relationship, because the trust has to be there in order to get adequate medical care. We take the HIPAA laws very seriously. The privacy is, as it should be. We want to make sure that patients understand that we're dedicated to you at the moment, just like we would be in a patient's room. So it's excellent for those patients to be able to see the provider without having to get out of their home.
Excellent. Who is using these services? Is this all payer types? Are there some people that can versus can't use the services right now?
So most insurances are covering telehealth right now, specifically because of the COVID initiative. Insurances are recognizing that it's beneficial for patients to be able to be seen in their home and protect themselves while protecting others and following CDC guidelines. What we hope is that in the future, once COVID is gone, that we will be able to continue to use telehealth and that it will become a more normal, modern part of medicine. But if a patient does not have insurance, that should not be a barrier to their medical care. So we do offer a $75 self-pay rate for patients who are, not able to be insured or for whatever reason, are not having help with the payment part. But that is significantly less than it would be in the clinic. So we feel that that is fair in that patients, we want them to have the option to use telehealth if that's, something that they need to do without having insurance.
Great. So Fast-Paced Health has roughly 130 clinics. We have brick and mortar, actual clinic locations. How does telehealth integrate with what we have in the ground out there in the 5 states that we're in?
Sure. So our providers that are seeing patients via telehealth actually came from these clinics. We are siblings, if you will. So we work very closely with them. All of our medical records are shared. It is something that we have a very intimate connection between telehealth and the clinics, and we hope that patients who have been seen with Fast-Paced before are not hesitant to use telehealth, because we are, very in tune with each other. And if a patient hasn't been seen with Fast-Paced before, if they want to be seen with telehealth or in the clinic, it is very versatile between the two of us.
Telehealth is very popular. We're not the only people doing it.
Right.
It's growing. What differentiates fast-paced telehealth from the rest of telehealth that's out there?
Fast-paced in general has been known to extend medical care to rural communities, and I think that's excellent. That's something that Fast-paced has always done and really made it their mission. So telehealth, since it has become a part of Fast-paced, has just really extended these hands to not just the rural part of the community, but to the whole state that we are servicing as Fast-paced. So we are able to get health care to people everywhere, not just in specific communities. And we really expect that this will have a positive impact on patients that may not have access to health care where they're at. If they don't have a clinic down the street, that's okay. For example, if you signed in Louisiana, you might actually see me. So we are regular people, providers who practice medicine on a regular basis.
How often does that patient actually get to see the same provider? Do they get to see, is it you, Lindsay, I'm going to see the same patient multiple times, or am I going to get a different provider every time I call in?
So we have 4 dedicated providers that work exclusively with telehealth, and in those specific states, you have 1 out of 4. So typically, you could get the same provider multiple times. I've seen the same patients multiple times. It's not anything that's unheard of. And because we do see these patients on multiple occasions, sometimes if it's a patient that I'm used to or that expects to see me, I will go out of my way to make sure that that patient is seen by me. And the patient-provider trust is extremely important for medical care to reach the heights that it needs to be at, because patients really will open up and speak more in depth about their health and things that might be otherwise unknown if they don't trust deeply their medical provider.
If I'm a patient that needs telehealth services or healthcare services, what do I need from a hardware perspective or from a knowledge perspective, and what's the process I need to go through in order to get to reach you?
From a hardware perspective, it would be a smartphone or a tablet, anything that has a webcam, even a laptop if that's appropriate. And as far as knowledge, very minimal. We want everybody to know that this is extremely easy. All you have to do is be able to sign in via internet. And if you're having trouble registering for whatever reason, we have a set of dedicated call center staff that are expertly trained to troubleshoot and help patients sign in. So if they notice that they're not making any progress on their registration, they will reach out with a phone call personally to aid. As far as what a patient can expect when they're being seen by us, let's go with an example of a patient having a rash. So they would sign in, the telehealth call center would call them, get all their information, take a payment if that's necessary, and whenever the provider is ready to see the patient, they will send the patient a link that they will click, and a video conference will come up. So it will be the provider on one side and the patient on the other side. And we are going to initiate the visit just like we normally would in the clinic. We would be able to talk to the patient about their symptoms, give a diagnosis, give treatment, and send the medication to the pharmacy. We are able to send medical records, work notes, things like that. So the only thing that's going to be different than it would be in the clinic is physical touch.
And what would happen if there's something that I would need from a testing perspective, or maybe I would feel the need that someone would have to do a special test or put their hands on me? Is there an ability for us to get those patients to other providers?
Absolutely. As we spoke about earlier, we are very close-knit with the fast-paced clinics themselves. So if we do receive a patient trying to sign in with telehealth that might not be appropriate for our service, what we would do is explain to the patient, for this reason that you need a higher level of care, we really think that you might need someone to put their hands on you for a physical exam, or you might need this specific lab test. Here's the nearest fast-paced clinic to you, and we will send you there specifically. If there's not a nearest fast-paced clinic to them, we would just advise that they go to a clinic where they can get a physical exam.
Let's say I'm a patient that has COVID, or I think I have COVID. Is telehealth an avenue that can help me, or do I need to go and get further testing, or do I need to go on site to determine whether or not I need a higher level of care?
So to answer your first question, if you already have COVID and maybe you have seen somebody else and they've diagnosed you with COVID, and you just want to make sure that you're doing the right things and handling the situation as according to the guidelines, we can absolutely help you with that. We can talk to you just like we normally would with counseling, making sure that you're following the guidelines, checking up on you, making sure that everything's going appropriately. So that's something we definitely do is COVID follow-ups. If you think you might have COVID and you're not sure, you're having some of the symptoms, potentially want to be tested, you can absolutely call telehealth. We are prepared for these questions. We are absolutely following the CDC guidelines, making sure that we are recommending patients in the correct manner. If you do not need to be tested for COVID, we will let you know, give you the reasoning, maybe that you're not in guideline with the CDC, or maybe if you do need to be tested, we will go ahead and do that as well. It's up to the provider's discretion that you are seeing, so whenever you sign in for COVID-related issues, you will be directed to a provider who is trained and making sure that they're following the guidelines of the CDC, and they will direct you to the appropriate avenue.
So in a way, you're a bit of a gatekeeper as to where people can go for a higher level of service. Talk about that in terms of healthcare costs.
In terms of the gatekeeper aspect, I'll start with that. So sometimes patients aren't sure if they even need to be seen for their symptoms at all whatsoever. They might think that it might not be enough per se to be seen by a medical professional. But I will say with telehealth, because it is so easy and it doesn't require too much forethought and having to plan and go to a physical location, if something is bothering you enough to where you have to think about whether or not you need to be seen for it, it's obviously affecting your quality of life, and just call us. We'll talk to you about it. Whether or not you need treatment is up to the provider's discretion, but you have nothing to lose. You go ahead, call us, we'll get it checked out, and we'll let you know if anything needs to happen or further recommendations on care. In regards to the higher level of care, we also do see patients that we might not be able to treat definitively, but we can give them the recommendations that we have for them at that time.
Sounds like a no-brainer to me.
Sure.
Versus me thinking I have something going on medically and immediately going to the emergency room or immediately seeking out a specialist. I would imagine that would assist in the whole healthcare costs and the rising cost of healthcare.
Right, and with the healthcare costs, the payers that we do work with, they really like the fact that we are able to service a wide range of symptoms and a wide range of specialties. So we can also treat patients any location in the states that we practice in. So that is Tennessee, Kentucky, Louisiana, Indiana, and Mississippi. So those states, we are able to not only target those areas that we have clinics in, but statewide with telehealth. So the payers that we use, they really like that. We're able to bring care to the whole state. In addition, we are able to send them to specialists if that's necessary. We do also offer specialty services here at FastPace, one of which that we work closely with in telehealth is behavioral health, because with the rise in COVID and the rise in mental health and anxiety, so it kind of comes with the territory. So it's good for patients to be able to feel that they're being taken care of by the same people who are working really closely knit with each other.
So tell me about the specific barriers to healthcare that telehealth can help with.
Sure. So telehealth being a virtual service, not all patients have the ability to go to the doctor's office to make it there for whatever reason. They might not have the ability to have a car, get there for whatever reason, but also just for people who may not be able to leave the house. With COVID, we know that a lot of the children aren't able to be present in school, so a lot of those parents are having to stay home with their kids. For example, we have a lot of single parents that use our service to maybe treat themselves or their kids, because they might not want to pack up 4 kids and go to the clinic, or maybe not want to risk the exposure. So service is really good for those kind of people who either can't or don't want to leave the house, as well as financials, because this is covered by most insurances, and we also do offer specialty services. That is also another barrier to medical care.
So what else separates telehealth from on-site care?
One of the things that patients really do enjoy about telehealth is the ability to keep their visit confidential. Like I said, we do service a lot of rural communities, so in those towns and those environments, it is common for everybody to know everybody. So if you might not want to go to the doctor's office because, you might have the only car in town that's, bright orange, or you might not want people to know where you're, that you're being treated at a specific place for a specific reason, we want patients to know that it's extremely confidential between a patient and a provider. Nobody else has to be involved. It's you and the provider having that intimate interaction, and you're able to, get taken care of whatever you might need without having to get anyone else involved.
Last question.
Sure.
What's your favorite thing about working for Fast Pace Health?
My favorite thing about working for Fast Pace Health, I love the people that I work with. I think it's amazing the connection that we have with each other. The ability to reach out and somebody to grab your hand to help is probably my favorite thing about being a part of this team. I never feel that, I'm alone or that I need to make my own way. I always feel that somebody is there to help, and I want everybody to know that with Fast Pace, we are a very close-knit team. We take our culture very seriously, and we hope that that is reflected in the way that we treat patients and the way that people get the experience when they come to a Fast Pace clinic, whether it's in person or virtually.
Well, thank you, Lindsay. This was very enlightening, and we appreciate all you're doing for Fast Pace and all you're doing for the patients that we serve.
Yeah, absolutely.